Namaskara. I'm Dr. Navneeth Kumar, Orthopedic spine surgeon, specialist in joint replacement and spine surgery at Athreya Hospital. So, joint replacement anta matadaವಾಗ osteoarthritis is the most common public health problem. ಈ ನಡುವೆ ಎಲ್ಲ ಪೇಷಂಟ್ಸ್ಗೂ above the age of 50 are developing osteoarthritis. ಸೊ ಆರ್ಥ್ರೈಟಿಸ್ ಇಷ್ಟು ಕಾಮನ್ ಇರೋದ್ರಿಂದ ಇವತ್ತು ನಿಮ್ಗೆ ಒಂದು ಸಿಂಪಲ್ ಪಬ್ಲಿಕ್ ಇನ್ಫಾರ್ಮೇಷನ್ ಕೊಡಬೇಕಂತ ಅನಿಸ್ತು ರಿಗಾರ್ಡಿಂಗ್ ದ ಸ್ಟೇಜಸ್ ಆಫ್ ಆಸ್ಟಿಯೋಆರ್ಥ್ರೈಟಿಸ್. ಸೊ ಐಲ್ ಬಿ ಎಕ್ಸ್ಪ್ಲೇನಿಂಗ್ ದ್ಯಾಟ್ ವಿತ್ ಸರ್ಟನ್ ಮಾಡೆಲ್ಸ್ ಐ ಹ್ಯಾವ್ ವಿತ್ ಮೀ ಟುಡೇ. So let's focus on that. So this model here is that of a normal knee. So what you see here is the thigh bone called the femur, and this is the leg bone known as the tibia, and what you see in between is of course the meniscus, and this is another small bone in the leg known as the fibula. So this white matter you see here, as I said, is a meniscus, is the sponge which gives the cushioning between the two bones and ensures smooth movements. And we have two important ligaments which you can see here, the collateral ligaments, and of course interiorly you have the cruciate ligaments. So this is a normal knee. This is how it looks. As you can see, the blue color indicates the articular cartilage here, which is completely smooth and it's not worn out. And this is how a normal knee looks like. So after this, we have the next model, which is depicting the next stage, the early stage of arthritis. So what we see, the main difference which you can see here is the red color, which depicts the loss of articular cartilage. This is the result of articular degeneration. So the patient starts to become symptomatic at this stage. They complain of knee pain, and the meniscus is reducing in height. So therefore the cushioning capacity of the knee joint is reducing, and therefore the shock absorbent capacity of this meniscus has reduced, and the patient starts to develop pain at this stage of arthritis. So coming to the next model, which is a model of moderate osteoarthritis. So as you can see here, the degeneration has spread all around the knee joint. There will be similar degeneration in the tibial articular cartilage as well, which is not depicted here, and the meniscus also is worn out completely, but obvious osteophytic lipping hasn't begun yet. In this stage, the patient begins to limp, have difficulty walking and doing their day-to-day activities, but still they remain ambulant. And the final model here I have is that of a case of severe osteoarthritis. As you can just see from the start itself, you can see that it looks like a melting candle. These are all the osteophytes which are formed all around, and you can clearly see that there is a profound degeneration in the articular cartilage, and the meniscus is almost absent, and there is bone-on-bone arthritis. The bone is touching the other bone in an attempt to increase the surface area and may stabilize it. So this is a very severe form of arthritis, and the patient is debilitated and are not able to do even their day-to-day activities. They are bedridden and need knee replacement at the earliest. So now that you know the 4 different stages of arthritis, you are better informed to when to approach the doctor with your ailments. For more clarifications and consultations, please meet me at Athreya Hospital.